let's go over a few meds. So just to get familiarized, we have different containers and medications. First we have here is a vial medication. They come many different sizes and shapes. They usually have a little flip cap on the top that you end up breaking out the top, and that'll expose a rubber stopper. Inside is the medication that you'll be drawing up. So we have vial medication. In other ones, we may also have ampules. So in this case, this medication is completely in a glass type of vial, but it has this point. So it's an ampule. As the medication, then we would clean off the neck of this and then crack this ampule, and medication would then be taken from inside of this. And the last one is a preload. So in this case, the medication comes out. We have some flip tops that we take off. These then will be screwed together, and the medication is prepped. We then purge the air out, and we're able to get a preload. Again, these are all in different sizes and forms, but basically vial medications where you pop the top off, and a rubber stopper needs to be cleaned before getting the medication out. Your ampule medication, which you would shake down all the medication from the tip before cracking the top and then drawing the med out, or putting together your preload, evacuating the air so that this medication is now ready to be administered. Another type of medication is one that is like a carpuget. It comes like a preload, but it requires you to have this extra device here in order to, in order to lock this into place. By locking the back of this syringe tip in and then turning this lock on this carpuget, it engages and perforates the rubber stopper up here, then now allows us to administer our medication. So similar to a preload, but requires us to put this carpuget on so that the medication can be expelled out like a syringe. Okay, so some quick medications. As we go over medications, it's important to know that you want to find out, well, what is it? What it is, it means is what kind of class it is and what does it do, right? So what it is. And what is it used for? What kind of conditions or medical emergencies are we going to be using it for? When is it contraindicated or when we should never use it? And any other side effects. This could be known side effects or adverse side effects like an allergic reaction. As well as knowing how much to give and how frequently to administer that medication. So you're going to have to review a lot of these medications on your own. We'll just go over a few right now. So aspirin, it's a salicylic acid. It's an analgesic antipyretic, which means that it numbs the pain and then it breaks down the swelling. Oh, excuse me, it breaks down the fever. So it lessens the fever threshold. It's also an analgesic. So antipyretic, analgesic, anti-inflammatory, and it's also an antiplatelet, so it stops the platelet from aggregating, or these are blood clotting factors that causes the blood to clump, and this stops it from clumping. Now, that's just its vague breakdown of the medication. Aspirin, again, usually we give 162 milligrams, or 325. This is given by mouth, the person can chew on it or swallow it. It is given so that we use this when it's indicated for somebody that's having angina or possibly acute coronary syndrome type of case. We would not give this to them if they have any type of bleeding ulcers or they're already on some type of blood thinner that would cause them not to want to take this. So aspirin. Nitroglycerin is an anti-anginal. It causes some vasodilation. In the case of acute coronary syndrome, it allows the coronary arteries to become dilated so that we can have blood flow pass through some of the blockages, or it'll increase the amount of collateral circulation by hopefully dilating arteries that supply blood around the blockage. So it is an anti-anginal and it causes the dilation of arteries and blood vessels. What we also know is that it may also cause somebody to have a facial flushing, it may also cause a headache, and it may cause the blood pressure to drop as it causes blood vessels to dilate. We give 0.4 milligrams under the tongue. We give 3 doses. Every 5 minutes we'll give a dose. And this is again given for acute coronary syndrome, and that's the only type of chest pain. Another common medication is called epinephrine or adrenaline. The body makes this from the adrenal medulla. Now, this medication is given in this preload sense or in this ampule. Now remember, in the ampule, we're going to draw this up, and this would be given for your allergic reaction. In this case, the preload is given for your cardiac arrest victim, somebody with no pulse, and they're not breathing, and CPR has been in progress. Now, epinephrine is a catecholamine. It basically is something that constricts blood vessels, makes the heart beat faster, better, stronger, and much more contractile. This is going to cause a lot of your alpha and beta type effects. This is usually given in a preload for the cardiac arrest victim. Preload will come out, you'll pop off the caps, you'll assemble your preload, you go ahead and prep it, take the air out, exhaust the air, then it's ready for the paramedic to then administer. We're giving 1 ampule or 1 milligram, 1 to 10,000 in this case, every 3 to 5 minutes in our cardiac arrest victim. Other medications are glucose or dextrose. In this case, is D25, 25 grams of D50. This would be given, this is a carbohydrate, it's sugar water. It'd be given intravenously. We'd give this for a condition called hypoglycemia, where the blood sugar is really low, causing altered mental status. In most cases, your patient is insulin dependent diabetic. We would give this through the IV. This would elevate the blood sugar in the circulation, causing their mental status to improve. Some issues is that we really need to have a good IV so that the medication can flush through there, or it can cause tissue necrosis if it starts to extravasate or leach out of the blood vessel area. So we need to really make sure we have a patent or well-running, working IV line. In all senses of things, for us, we learn about oral glucose. Oral glucose is given in between the cheek and gum. This is only given if the patient is conscious enough and has a gag reflex so that we don't cause them to aspirate the contents that we're putting into their mouth. This would be given for somebody that's having a hypoglycemic event, usually against somebody who's an insulin-dependent diabetic that hasn't eaten but is taking their insulin. Their blood sugar would read below the normal ranges of less than 70, but causing altered mental status. So again, oral glucose, some indications, some contraindications. Now there are a few other medications that you want to learn about. Succinylcholine, which is our paralyzing agent. We also have etomidate, which is an amnesic agent. These are combined and used in our PADI protocol or rapid sequence intubation, where we go ahead and take over the patient's airway when they need, because they're unable to ventilate and exchange oxygen and carbon dioxide. So we're chemically sedating and paralyzing them so that we can in place an advanced breathing airway or breathing tube for them. We have other things called antidiuretic, a few of them. One's called lidocaine, another one's called amiodarone. These are used in the event of sudden cardiac death or in a patient that has ventricular tachycardia and ventricular fibrillation. Now, in some cases, our patients in ventricular tachycardia may still be conscious and have a pulse, but that pulse and blood pressure is too faint or too weak. It's because the ventricles have overridden the pacemaker site. And so as the ventricles try to exact amount of blood flow from the ventricle and out to the body, it's inappropriate or inadequate. And so it's going to require us to give either lidocaine or amiodarone. And we also want to think about using other means like electricity. Another drug is called Narcan. This is a reversal agent. This is a competitive antagonist against any type of heroin or narcotic overdose. So our patients that may be taking something like fentanyl or pain medication that are opiates, such as morphine, This medication competitively binds to those opiate sites, making that medication not work in the body. This is also given IV, IM, or intranasal through nasal atomizer. So take a look at the rest of the drug bag. Go over them. Remember, figuring out whether or not, what is it, what class, or what does this drug do? When is it indicated? When do we give it? When is it contraindicated? When we don't give it? And then how much do we give, and how frequently do we give it?